Texas today took a big step toward becoming a leading center of cancer research, and Fox 4 medical reporter John Hammerley joins us with the details.
Baron, it's not a done deal yet, but Texas is one step away from having $3 billion to spend in the fight against cancer. Governor Rick Perry signed a bill this morning creating a cancer research institute, but voters still must approve $3 billion in bonds this November. Flanked by legislators and 7-time Tour de France winner and cancer survivor Lance Armstrong, Perry said the Cancer Institute will help cut down on the 35,000 Texans who die every year from cancer.
And if you consider the amount of people that are actual survivors, but then you go beyond that, you know, husbands, wives, children, neighbors, co-workers, fellow students, it touches everybody. Really, I guess you would have to say it almost touches everybody in the world. So you hope that helps you when it comes time to vote on it.
85,000 Texans will be diagnosed with cancer this year alone. Armstrong also said any discovery made in Texas will be shared with the world. The American Cancer Society has released new guidelines to try to pinpoint the early diagnosis of ovarian cancer, a disease that kills about 15,000 women in the U.S. every year. The American Cancer Society and other groups have released a consensus listing the symptoms like weeks of bloating, the need to urinate frequently, eating changes, and abdominal or pelvic pain. Ovarian cancer is hard to spot and as a result is one of the deadliest cancers. It is a depressing statistic and one that is destined to haunt the generation of children now growing up. 1 in 3 American kids is overweight, and a new panel of doctors now believes that pediatricians have been too nice when talking about it with families. High school junior Braxton Davis is shooting hoops this summer. He's been working out more and eating less to get his blood sugar down to a safe range.
We were told that if he doesn't lose the weight and continue to lose the weight, that within 5 years he could possibly be on dialysis because of the damage that will be done to his kidneys.
17% of our children are obese now, with a third of them actually overweight as well.
Faced with these frightening facts, a national medical panel is now telling pediatricians not to beat around the bush. If a child is overweight or obese, doctors need to directly tell parents without sugarcoating their diagnosis.
As health professionals, we've been a little bit reluctant to label children as overweight or obese.
Hello.
Dallas pediatrician Marjorie Malici sees both sides of the cut-to-the-chase approach.
I think we definitely have to make sure that they know the risks of being overweight, and being overweight as a child will lead to long-term obesity in a huge majority of the kids. So
pediatricians now say they are seeing diseases once only seen in adults. Type 2 diabetes, high blood pressure, even heart disease in overweight children. But Dr. Malici says this new recommended straight talk can backfire.
Most of the children know that they're overweight. You're not telling them anything they don't know. It's very rare when they are surprised when you tell them they're overweight, and they're already very self-conscious. There's a lot of social issues around this. And what you don't want them to do is flip and become a child that has an eating disorder.
Neither the new recommendations or pediatricians we talked with believe doctors should ever use the word fat.
I much prefer overweight and obese and morbidly obese than fat. We see too many kids shut down. They realize that there's a problem, and you call them fat, which they already know, that just makes them not want to come back to the doctor.
One pediatrician on the committee formed by the American Medical Association said using fuzzier, politically correct language often lets doctors off the hook from dealing with a child's obesity. The new straight talk recommendations are endorsed by the American Academy of Pediatrics and the American Dietetic Association. For more health headlines, log on to our website, myfoxdfw.com, and click on Health. I'm John Hammerley, and that is For Your Health.